welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Can financial incentives help people quit smoking? Rewards and financial incentives are successful methods to help people quit smoking, according to a new Cochrane review. For the first time, the researchers also found high certainty evidence that this intervention works for pregnant people as well. The latest review included 47 mixed population studies, including 14 new to this review, with just under 22,000 participants. The researchers again found the high certainty evidence that financial incentives improve smoking cessation rates at long-term follow-up even after the incentives are withdrawn. Separately, the researchers looked at 13 studies from the US, UK and France with 3,942 pregnant people participating. For every 100 pregnant persons who received financial incentives, 13 were likely to successfully quit smoking at 6 months or longer compared to 6 in 100 who did not receive financial incentives. How gender and body size gaps in guidelines put women at risk for heart health. Women may be missing a diagnosis of a potentially deadly heart condition due to guidelines that don't account for natural differences in sex and body size, according to a new study led by UCL researchers. The findings are published in the Journal of the American College of Cardiology when they tested their updated approach in 1,600 patients with clinically diagnosed hypertrophic cardiomyopathy. The researchers found that it was particularly beneficial for women, increasing identification by 20 percentage points. The new method takes people's age, sex and size into account to determine whether their heart muscle is dangerously large. As well as preventing people being missed, it could also reduce the number of people misdiagnosed with hypertrophic cardiomyopathy. Procalcitonin test does not reduce IV antibiotic treatment for kids, study finds. A new study found that using the procalcitonin biomarker to guide treatment decision did not reduce antibiotic duration when compared to usual care for children. The study, published in the Lancet Child and Adolescent Health, is part of the biomarker guided duration of antibiotic treatment in children hospitalized with confirmed or suspected bacterial infection, that is the BATCH trial. BATCH is a national research trial to tackle antibiotic overuse in hospitalized children and reduce the spread of antimicrobial resistance. The study, conducted across 15 hospitals, enrolled nearly 2,000 children aged between 72 hours and 18 years with suspected bacterial infections. The researchers found that adding the PCT test to routine care did not reduce the duration of IV antibiotic use. The test was safe but costlier than standard methods, and healthcare teams faced challenges integrating it into their decision-making processes. Smoking may reduce earnings, study finds. A new paper in nicotine and tobacco research finds that smoking has a negative effect on earnings among younger workers. This is particularly true among the less well-educated. Researchers here use data from the cardiovascular risk in young Finns study, a longitudinal analysis of 3,596 participants from urban and rural areas of 5 Finnish university regions born between 1962 and 1977. They link this data to labor market outcomes from statistics, Finland, and parental background information from the longitudinal population census using personal identifiers. The observation period starting in 2001 covered people aged 24 to 39. The researchers assessed smoking using pack years. The researchers found that a 1 unit increase in pack years was associated with a 1.8% decrease in earnings. This suggests that reducing smoking by the equivalent of 5 pack years could lead to a 9% earnings increase. Additionally, the investigators involved with this study found that a 1 unit increase in pack years led to a 0.5% decrease in years employed. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.